The Cayman Islands Health Services Authority's general practice and public health clinics have relocated to Smith Road Medical Center. At the new location, you'll receive top quality care in a comfortable, modern space, enhancing your patient experience. Do you have flu-like symptoms or other non-emergent illnesses or injury? HSA's new urgent care walk-in clinic is now open at the main hospital campus. The new general practice location is for appointments only. For more information, call 949-8600 or visit hsa.ky.
When you have a sports or fitness-related injury, trust the expertise of the HSA Sports and Exercise Medicine Clinic to get you back in the game. Our internationally trained and certified physicians specialize in sports traumatology, sports medicine, pain management, and orthopedic surgery. For treatment of common injuries such as tendonitis, arthritis, tennis elbow, rotator cuff, or knee tears, schedule a consultation with the Sports and Exercise Medicine Clinic at Smith Road Medical Center by calling 949-8600 or visit hsa.ky for more information.
Health Services Authority is now offering online payment options for patients. Patients of HSA can now pay their bills, including deposits, towards scheduled services online at payments.hsa.ky. The secure, new online payment system accepts debit or credit cards and is in addition to the available payment options of cash, check, and online bank transfer. For quick, easy, and secure payment directly from your phone or computer, visit HSA's new online payment system at payments.hsa.ky.
The Health Services Authority's new pharmacy is now open at the Smith Road Medical Center. The new location features a large, comfortable waiting area and ticketing system to improve the patient experience. All uncollected prescriptions and refill requests previously submitted will now be available for collection at the Smith Road Pharmacy. Request your refills online at hsa.ky via WhatsApp 925-6534 or call 244-2715. For more information about our pharmacy hours, visit hsa.ky.
At the Health Services Authority, we want to keep you informed about the latest developments that impact your health because your health matters to us. Join us each Friday and Saturday from 1 to 2 p.m. as we cover health news, offer advice, and answer your questions on Healthcare Today with HSA.
Welcome back to Healthcare Today with the HSA. I'm your host, Chuck Taylor. Thank you so much for tuning in. Each and every Friday and Saturday, we get together at 1 p.m. and talk about all things related to your health. Now, this is the time of year that I really love because I get to talk about something I think prepares our young people for the future. Give them some thought process, give them some ideas, and also some options. And I will have with me here, go ahead and introduce yourself, please.
Okay, my name is Marsha Eleweanya, and I'm the Training and Development Manager at the Health Services Authority.
And when you say training and health manager, what does that consist of?
That consists of ensuring that all our employees, at the moment we have over 1,200, are equipped with the necessary skills and expertise that they need to continue their job. While we do have most of our employees coming in with qualifications, we need to constantly update the training, make sure that we're current in providing healthcare to all our clients. So that's part of it. And today I'm going to speak to you about another part of my role, which is providing experience for young people out there who are just entering the healthcare field or who are thinking about it.
Exactly. And that's where I'd really like to kind of tone in, because right now our young folks are thinking about summer jobs, summer internship, and also maybe not really sure of what they want to do. You know, they're looking for options. Of course, you know, we have been, and I laugh, I say we have been a financial community for many, many years. We've been a tourist community since the beginning of time, but there are other options for them to kind of look at and dig into and still kind of encompass the island lifestyle and that island way of living.
Absolutely. So we do have other options, and we want our young people to know that we're not just finance, we're not just tourism, but we are healthcare, heavily healthcare based as well. And so they do have lots of options in the healthcare field. Additionally, I want to say that healthcare is not just clinical. And so for our young folks, we don't want them to think about only nursing, physicians, radiology. We want them to think about IT, marketing. Mm-hmm. So those are other options. Human resources, those are other options in the healthcare industry as well that they could think about when they're thinking of choosing a profession or joining a team.
And I don't think that they realize that that is also a viable option for the future because now literally you are able to work in one location and be employed in other or even regionally in that aspect.
Absolutely. So you can be employed anywhere. You can be employed in Cayman Islands, but your company is somewhere else. And so because we're a global environment that has gone IT related, so most jobs are now virtual. And even when you're working with the hospital, you can do a work from home day. So depending on what your role is, you can have all those options in healthcare that you have in other industries as well.
Wow, incredible. Folks, we're going to take our first break and come back, and I'm going to dive right into the HSA's Summer Student Internship Program. Thank you so much for tuning in. This is Healthcare Today with the HSA. I'm your host, Chuck Taylor. We're going to be back in just 2 minutes.
When you have a sports or fitness-related injury, trust the expertise of the HSA's Sports and Exercise Medicine Clinic to get you back in the game. Our internationally trained and certified physicians specialize in sports traumatology, sports medicine, pain management, and orthopedic surgery. For treatment of common injuries such as tendonitis, arthritis, tennis elbow, rotator cuff, or knee tears, schedule a consultation with the Sports and Exercise Medicine Clinic at Smith Road Medical Center by calling 949-8600 or visit hsa.ky for more information.
The Health Services Authority's new pharmacy is now open at the Smith Road Medical Center. The new location features a large, comfortable waiting area and ticketing system to improve the patient experience. All uncollected prescriptions and refill requests previously submitted will now be available for collection at the Smith Road Pharmacy. Request your refills online at hsa.ky via WhatsApp 925-6534 or call 244-2715. For more information about our pharmacy hours, visit hsa.ky.
The Cayman Islands Health Services Authority's general practice and public health clinics have relocated to Smith Road Medical Center. At the new location, you'll receive top quality care in a comfortable, modern space, enhancing your patient experience. Do you have flu-like symptoms or other non-emergent illnesses or injury? HSA's new urgent care walk-in clinic is now open at the main hospital campus. The new general practice location is for appointments only. For more information, call 949-8600 or visit hsa.ky.
HSA's cardiology clinic is now located at Smith Road Medical Center. Our cardiology team provides expert care and treatment for heart conditions such as coronary artery disease, heart failure, arrhythmias, hypertension, congenital heart diseases, among others. The new location offers state-of-the-art cardiac diagnostic testing, including echocardiograms, ECGs, and stress tests. To contact, call 949-8600. At HSA, your heart matters to us.
At the Health Services Authority, we want to keep you informed about the latest developments that impact your health because your health matters to us. Join us each Friday and Saturday from 1 to 2 p.m. as we cover health news, offer advice, and answer your questions on Healthcare Today with HSA.
Welcome back. This is Healthcare Today with the HSA. I'm your host, Chuck Taylor, and we get together each and every Friday and Saturday at 1 p.m. and talk about all things related to your health. And this time, it's really guaranteed and dialed in for our young folks. We're talking about the HSA's annual Summer Student Internship Program. Now, this has been something that we have basically I personally have been involved with it about 3 to 4 years now, on and off, just, getting the information, but it continues to grow. And we have with us our representative. Go ahead and introduce yourself one more time for them.
Okay, my name is Marsha Eleweanya, and I am the Training and Development Manager at the Health Services Authority.
And so when we talk about Summer Internship Program, give me the broad view about it, and then we'll start breaking down, because you said you have over 1,200 employees overall for the HSA. That's a phenomenal amount of workers, and also staffing, and also people who are looking to train others. So give us a little bit the details about that.
Okay, so yes, we do. We have over 1,200 staff members who are willing, able, and excited to train our young people into the healthcare field. So if you're in high school or you're college graduate or you're in college, we're excited to have you at the HSA for you to gain valuable experience, expertise, hands-on with the career of your choice. So the internship program has been around for some time now, a few years, and it has grown significantly importantly, it provides, as I mentioned earlier, valuable experience for young persons. Some persons who may not necessarily know exactly what they want to do, but they just want to come and have a feel. What is it that the healthcare has to offer me? And for those persons who know what they want already, of course, we can place you specifically in those areas.
And I think that is a great starting point, because a lot of our young teens don't know kind of what they're going to do. They may have one or two interests and likes, but to dial in to say, I want to do this for a career, because that's what we're really dialing for, is not just a job. We're looking for you to build a lifelong career, something that you're happy to grow with, something that you're going to be manifesting and just feel great about.
Yes, absolutely. So we want our young folks to come in and say, okay, let me try this. If that doesn't work for you, then you can always switch to something else. So you can try that out as well, because it's always best to choose something that you're going to have as a lifetime experience. So don't think of it as just a job. Okay, this is just something to give me salary at the end of the day. You want to enjoy it, because the more you enjoy what you do, the better you're going to be at it. And persons are going to receive the better part of you as well, because you're happy doing the job.
Exactly. And as I said, this is a great opportunity for our kind of to get a gist of what it is, because suppose this particular person, I'm just using this, I'm an IT, and I may feel great about that, but then you get in there and you see you're starting to look at phlebotomy or looking at different areas, and you start specializing and looking at, because it is a ton of wealth in the field of health. It's just not one thing to say, okay, everything is a doctor, everything is a nurse. There's a ton of supporting staff that goes along with each one of these departments.
Yes, absolutely. We do have a lot of support areas within the hospital. So we have our phlebotomy, as you mentioned, and those folks, without them, we cannot come to a conclusion. We need lab tests. And so the physicians make even the nurses make their conclusion what's going on with the patient based on the results from that. We do have all the support areas. We have porters. They transport our patients around. We cannot do without them. They transfer blood to the blood bank. We have even our housekeeping. So don't think about, okay, I need to have a degree. You can start from somewhere. So we have from our housekeeping department all the way up to administration. And so we want our young people to know that whatever it is that you're thinking of, there is a place for you in healthcare. So don't think about it as only the foundation where you have to be a clinical person, a physician, or a nurse, because we do have a lot of support service. We have biomed, where you can actually fix the machines that we use in the hospital.
Yes.
So we do want young people to come in as engineers. Right? We have buildings, so we want architects.
Right.
So we don't want you to think clinically only. We want you to think outside the box. How else can I support? So think of it as a business. So whatever the areas are, we do have them in healthcare as well.
And it's amazing, because normally, and you kind of bring up some great points. In the past, healthcare was only thought as, I'm taking care of the health, not I need to make sure that the building that they're working in is safe environment. I got to make sure that they're able to get this information from so and so at a timely manner. And you brought up a great thing, the engineers that actually have to calibrate the machines that take so there's a lot of moving parts that our young people can be excited about. And also just think about it, this is prelude to your first job.
Yes.
Even though it's a job, even though, because do they get paid for this too?
They actually do get some compensation for
Wow. Okay. So folks, think of it this way. You're able to make something while you're building towards something else. This is a great opportunity. So let's get into kind of details. So when does this process kick into gear?
This process, so applications are open April 1st and they close April 30th. So anyone wanting to join the program, you just need to go on our website, hsa.ky, fill your application in, and also upload the documents required, because we're only taking applications through the website. So you need to make sure that you're completing the process on the website. So April 1st and close April 30th. But the program itself starts in June.
Okay. Okay, excellent. Now, this program has been around for many, many years, and it's increased in popularity. I would assume that you have quite a bit of interns coming back, and also information that you're taking about the future ones also.
Yes, absolutely. We have over 100 each time we do this program. We have over 100 applications that we process. Now we're looking more into having quality experience for our students or young people. So we are not just taking all the applicants. We are going to select some of the applicants, and then we're going to ensure that their experience is one that is valuable to them, and also help them to make up their minds as to, is this what I really want to do? And for those, you may not choose healthcare, and that's fine. You would have gotten that experience. You'd have known one thing off the box. Okay, I don't want to do this, but I want to. You may see something else, or a friend may have an experience and say, you know what, this is what I did. And that may pique your interest, and so you may want to try that next time. But we do have lots of opportunities, as I said. We talking about accountants, because we do have a business office.
Okay.
So we have registration area. We have patient experience where you get to meet, greet, have conversations with persons. So we have pharmacy technicians. So we do have a lot of possible areas where we can place young people. So don't just focus yourself on only one area. Explore, and even on our website as well, you can go onto hsa.ky to see the offerings of the health services as well. So you can choose from there. There's a listing, and so you can look and see, okay, what does this person do? What is this role? You can go on our website to find the information as well.
I think that's great, because a lot of times our young folks, and everyone you're so tech savvy nowadays. You break down what the individual roles consist of.
Yes.
And that's something that you can't find on a website. You can't find that just on so the HSA break down very distinctively, say, hey, if you do apply for this role, this is what it consists of. This is how you will be approached. And also, folks, for all the young folks that's tuning in, our moms and dads, our aunties and uncles, help them put that resume together. Help them say, you know what, even though you're online playing games, you're a social person, because you communicate, you explain to me what you're doing. So that in itself is a skill. So be very open to wording and understanding, so that you can help the HSA make these decisions, because it's a great starting point.
It is a great starting point. As I mentioned, if you're good with technology, why not try our IT department? We have variety. So our IT department, we have both clinical areas, so persons who help to build the platforms for the clinical folks to work in. We have those persons who help to fix the machines, upgrade the machines, help the persons to log on to the machines.
Right.
So we have different aspects in IT that persons can fit in. So absolutely, parents, guardians, please encourage the young folks to apply, assist them with going through the application. It's pretty simple, just to fill the information that's needed there, and then they need to put together a nice little resume to say, here we are, here I am. I don't have much experience, which you don't need for this program. Actually, you just need to place the application there and to tell us that you're interested and why you're interested. Okay,
excellent. So I know we have our island has a great biology department. A lot of teachers tune in to listen here. Get your young folks excited about this. Make it an afternoon to say, hey, if you're thinking about an internship, let's go ahead and go online, and you do it as a class project. This is one of the things that I love about our society. We have great pockets of understanding, and also great technical sides of it. Yeah. We're going to take a quick break, folks, and come right back. You're listening to Healthcare Today with the HSA, talking about their upcoming summer internship program. You definitely want to be about it. And folks, try to be proactive. I know I love my West Indian folks, but sometimes we delay. You only got a month to get this done. So we're going to come back and give you some more details about it. Thank you so much for tuning in. We'll be back in 2 minutes.
Health Services Authority is now offering online payment options for patients. Patients of HSA can now pay their bills, including deposits, towards scheduled services online at payments.hsa.ky. The secure, new online payment system accepts debit or credit cards and is in addition to the available payment options of cash, check, and online bank transfer. For quick, easy, and secure payment directly from your phone or computer, visit HSA's new online payment system at payments.hsa.ky.
When you have a sports or fitness-related injury, trust the expertise of the HSA Sports and Exercise Medicine Clinic to get you back in the game. Our internationally trained and certified physicians specialize in sports traumatology, sports medicine, pain management, and orthopedic surgery. For treatment of common injuries such as tendonitis, arthritis, tennis elbow, rotator cuff, or knee tears, schedule a consultation with the Sports and Exercise Medicine Clinic at Smith Road Medical Center by calling 949-8600 or visit hsa.ky for more information.
The Health Services Authority's new pharmacy is now open at the Smith Road Medical Center. The new location features a large, comfortable waiting area and ticketing system to improve the patient experience. All uncollected prescriptions and refill requests previously submitted will now be available for collection at the Smith Road Pharmacy. Request your refills online at hsa.ky via WhatsApp 925-6534 or call 244-2715. For more information about our pharmacy hours, visit hsa.ky.
The Cayman Islands Health Services Authority's general practice and public health clinics have relocated to Smith Road Medical Center. At the new location, you'll receive top quality care in a comfortable, modern space, enhancing your patient experience. Do you have flu-like symptoms or other non-emergent illnesses or injury? HSA's new urgent care walk-in clinic is now open at the main hospital campus. The new general practice location is for appointments only. For more information, call 949-8600 or visit hsa.ky.
HSA's cardiology clinic is now located at Smith Road Medical Center. Our cardiology team provides expert care and treatment for heart conditions such as coronary artery disease, heart failure, arrhythmias, hypertension, congenital heart diseases, among others. The new location offers state-of-the-art cardiac diagnostic testing, including echocardiograms, ECGs, and stress tests. To contact, call 949-8600. At HSA, your heart matters to us.
Now back to Healthcare Today with HSA and our host, Chuck Taylor.
Welcome back to Healthcare Today with the HSA. I'm your host, Chuck Taylor, talking about the upcoming I want to say application drive, because you got about 30 days to do it before we actually get into the actual HSA summer student internship program. And we're talking here, and tell me when it starts again, the official date and all of that, details, and how long the program runs.
So the program runs from June 1st to September 15th. So it's about 4 to 8 weeks in terms of internship for students. So we do have a 2-month period where the student can, or the individual can come to us, because they may not be students anymore.
Right.
So they maybe have a graduate from college or graduate from high school looking to go into college.
Oh, okay.
And so the duration is over a 4 to 8 week period.
Oh, wow. So it's really open. Yeah. What's the age limit for the summer?
Minimum is 16 years.
Okay.
Right.
Okay. Excellent. So for all of my teens out there, this is a really great starting point for you. It's a quality program, and I will tell you, I haven't done school in a long time, but it looks good on your school resume. That's very good to say that, because you don't realize how special Cayman is. Cayman, despite us being a small community, we are recognized worldwide. It is literally unheard of for any teen to get an internship in a U.S. hospital, because it is all taken up by the hierarchy. So this is a great starting point for you to get in, and whether it's, looking at the Red Cross and all these other things, they look at this as a great starting point for how they approach programs in the future. So as you said, it's a great idea. And the time frame that they placement is from the start of the application process again.
Yes, for the application process, we starting April 1st and it closes April 30th. So you have a full month to apply. So once we open April 1st, you can go ahead and submit your application there, and we close off on April 30th. So we will not be accepting any application after April 30th. So please do get your application in within the 1 month period.
Within the 1 month period. And who can apply for the internship opportunity?
So to be eligible for the program, the person must be a high school or college student, and you need to be Caymanian or have the right to be Caymanian and at least 16 years old.
Those are normal factors, right, dealing here in the Cayman Islands. If we take a look at it, also, we really need you to be committed to it.
Yes.
And I say that because a lot of times, parents and stuff will push you, hey, do this. But there are so many different opportunities here. So even if you're a gamer or you like, Legos and you like buildings and things of this nature, or maybe you say, you know what, I want to go into finance, but hey, the biggest finance department is one of the HSA.
Yes.
You have literally the whole island that you deal with in some capacity in finance, not just, and I love my banks, but a bank only has a limited amount of clients. Here at HSA, you have the full entire island as a client, because at some point in time, someone has to use your service.
Yes, absolutely. So we have a vibrant accounts department who organizes and manages our budget for the Health Service Authority. And so there are tons of opportunities for young people to come on in. We do have also a procurement department as well.
I was just about to say that.
They purchase, that's the department that we go through to purchase anything at all we want at the HSA. So they're linked to the finance department, but that's an extension. And so young persons can think, okay, I may want to go into the procurement department. And that's an area where it may be new to you, and so you can explore what they have to offer as well.
Those are great business opportunities. Like I pardon for people who love shopping, for people who enjoy finding things, looking for better bargains, being able to compare products and being able to do research on that. The HSA has the procurement department. That is what they do. They find the best quality products at the best possible price for our clients, which is the community right here. So those are things to be excited about, and those are different ways of kind of changing the thought process of what a hospital does. Because as you said, in the past, we haven't really thought of it as a business. Yes. It's a hospital. Yes. It's a place where people go when they're sick or when they're trying to get better or you need a service. Yes. But overall, it is a moving, growing entity.
It is. And we do have materials management as well. So our materials management department is the one that actually goes out and source equipment. They source supplies for us. So whatever we need to use in the hospital, they source and have those in stock so it can be distributed throughout the hospital. So you can think of, okay, I could go to materials management as well. If you love to do the shopping, that's the department that you want to go into.
Right.
For sure. Yes.
Wow, incredible. And you have extended arms of it. So if I live in East End or I live in West Bay or even Cayman Brac, there are opportunities in those regions and those communities also?
Yes, absolutely. So we do have, so for folks in Grand Cayman, our materials management department is at the hospital in Georgetown, but we do have a branch over at Faith Hospital. And so persons in Cayman Brac absolutely can join the program because there are opportunities at Faith Hospital for all the areas actually that we speak about in Grand Cayman.
Wow. So folks, don't just think you're limited to one island. We have 2 and 3 that we deal with. So don't just think that you're limited to this. So this is open for folks in Cayman Brac also.
Absolutely. So folks in Cayman Brac, we're not leaving you out because we do have a vibrant entity, Faith Hospital there. We do have clinics as well. And so we want young folks in Cayman Brac to apply and also get the same opportunity as we would for those over here in Grand Cayman. And if you're in Little Cayman, you can apply and go to either of them. And we do have a clinic in Little Cayman. So there might be something that you can do in Little Cayman as well. So don't think you don't have the opportunity. You do have the opportunity regardless of which of the island you are located on.
Very, very excellent. And I just want to say, just for all the folks that's tuning in, you have to head on over to www.hsa.ky to fill out the online application there. And how long does the process take for them to kind of go through that?
I would think the process could take about 30 minutes. It could take less because our young people are pretty savvy.
Yes.
And so, but just to ensure that you complete the application properly, you want to make sure you fill each portion and present your essay properly as well. So that could take you some time to go through, making sure you're writing your essay to present yourself. Because we want people who are genuinely interested in the healthcare field to actually get that opportunity, that work experience, because it's invaluable to their first entry job.
Very, very true, folks. So, go ahead and make sure you do that, complete it online, and also fill out the essay and be you. a lot of folks nowadays, that excitement comes through when you start talking and typing and putting it down on paper. And that's what the wonderful folks over the HSA is looking for, to know who you are so that you can expire and grow in the process. Because I spoke last year, there have been people who have been 2 and 3 times through the system. They started when they were coming out of 16, they got into university, and then they come back later on and do another internship because they were so enthralled by it. And maybe they switched departments. Maybe you like to find out what it is to be an ambulance driver on a scene, or maybe you want to find out what it is to be an intake or in the triage area. And it is a great opportunity for you to kind of move throughout the community to figure out what you fit in and what you like best.
Absolutely. So think of it this way. When our patients enter the hospital, the first person greets them. Usually you have a receptionist area. So you could be there. From that reception area, you may move to registration. So you could also be enthralled in the area of registering someone to see a physician. Next, you move into the clinical area where you have persons who do the vital signs. So you can shadow someone. So if you want to be a physician, you could get into one of those areas where you're shadowing actual doctors going to see their patients. You could go into the lab area where we send our blood samples to. You could go into our finance department. That is more outside of actually having close contact with the patient, but you're still influencing healthcare.
Right.
We have even our health records management. So you're managing the records for persons who come in. That's where we store our data. And so we have a lot of areas students can actually go to have the experience. So when you come to the institution, explore, talk about it. Where else can I go? This is my interest. You may do your application. You're still not certain where you want to go. Come and speak with one of us and ask, okay, I want to go. Maybe you want to go into forensic. Do you have anything for us? We do have something for you. So regardless of what you're thinking of, tell us and we will guide you through what the best area is.
And I think, folks, if you're just tuning in, this is a prime opportunity to get kids excited, and I say kids, but get our young people excited about work ethic, working with the community, and also building that awareness of what it takes to make something as large as the HSA work. Because when you think about it, most people don't see the underlying layers of it.
Yes.
They see one layer and that's it, and it kind of gets disappeared with the rest of it.
It does, and that's because they're the support persons. So they're mostly those support persons in the background working. Just like a computer, you don't necessarily see inside. You're interfacing with just the screen. But then there's so many other things going on within that computer.
Right.
And so the health system is similar to that. So you always have those support persons who are saving lives. So our biotechnicians, if they don't program the machines to make sure they work properly, we may get wrong vital signs. We may get incorrect readings.
Right.
And so they're central to what we do. And so we always want those support persons to work with us. So as you mentioned, we have persons who just transport patients, and that's fine because we want persons to access the care as quickly as possible and making sure that they're transported by persons who can take care of them while they're en route to the hospital.
Right.
So we have persons who deal with the numbers. They purchase things for us. They're looking. We even have persons who collect for us as well. So we have persons who will call, okay, this is what your bill is. This is what you can pay each month. Okay, we'll give you a payment plan. And so you will have different areas. We have dietitians. We have the kitchen area where we serve meals. So we have a lot of area at the Health Services Authority that our young people can explore and find something. There's a niche for each of us. And
Right.
so you can actually get something from the HSA.
I remember a while back I ran into a student, they're in university, and they said their first culinary job was working in the kitchen at the HSA.
Yes.
And they said that they loved it, and that made them want to continue on to cook and things of that nature. And it was kind of one of those, they didn't know my connection, but I just kind of listened. I'm like, okay, wow, wouldn't have recognized it. They said, yeah, because they had never cooked for so many people at one time. It was always, for one person 3 people, but here they had to work with a staff, and they were cooking for hundreds of people.
Yes.
And each one had a dietary need, and they had to follow through on that.
Absolutely.
And it got them thinking about how to change the way how they cooked and things of that nature. So I think it's a great way of expanding our young people's horizons, letting them see as much opportunity as they can.
Yeah. And I do agree, because I must say, hey to our dietary department, they're wonderful, and the experience will be absolutely great for our young folks. It's an environment where it's vibrant, it's always changing. The meals are exciting, they're palatable, they're beautiful to look at. And I must say hi to Miss Sandra, who is the manager for that department. But we do have other areas in the hospital as well that are equally exciting. So we want our folks to come in saying, you know what, I'm going to give it a try. Because you never know, this may be the career for you. And I could not leave without saying there's also training opportunities. So you come in and say, you know what, I want to teach, but I don't know how I'm going to get in. So we have trainers, we have persons who teach fire training. We have persons who teach customer service. So if you are interested in something like that, you can also get experience through the HSA as well.
Wow. Okay. So they actually go through the process of helping train, say, okay, this is how you answer the phone.
Yes.
This is how you communicate. When someone calls, this is, you say department, and you work your way down to help them get through to where they need to go.
Absolutely. So we do have that as well. So we want the young people to come on in, whatever the area is that you're interested, you can find it at the HSA. There's nothing that you're looking for that you cannot find a niche at the HSA. From answering the telephone, to dropping off the blood at the blood bank, to shadowing a physician, going around with the nurses to see what they do, solving problems as well, because that's part of our customer service. A customer is having an issue. Problem solving is also what we do. It's part of a business. It's part of healthcare. So we want our young people to come on out so we can help them gain that valuable experience they need to take it next step.
Excellent. We're going to take a quick break and come right back. You're just tuning. You're listening to Healthcare Today with the HSA, talking about their upcoming drive for their summer student internship program. We'll give you all the details coming up in about the next 2 minutes. Keep it right here.
Health Services Authority is now offering online payment options for patients. Patients of HSA can now pay their bills, including deposits, towards scheduled services online at payments.hsa.ky. The secure, new online payment system accepts debit or credit cards and is in addition to the available payment options of cash, check, and online bank transfer. For quick, easy, and secure payment directly from your phone or computer, visit HSA's new online payment system at payments.hsa.ky.
When you have a sports or fitness-related injury, trust the expertise of the HSA Sports and Exercise Medicine Clinic to get you back in the game. Our internationally trained and certified physicians specialize in sports traumatology, sports medicine, pain management, and orthopedic surgery. For treatment of common injuries such as tendonitis, arthritis, tennis elbow, rotator cuff, or knee tears, schedule a consultation with the Sports and Exercise Medicine Clinic at Smith Road Medical Center by calling 949-8600 or visit hsa.ky for more information.
The Health Services Authority's new pharmacy is now open at the Smith Road Medical Center. The new location features a large, comfortable waiting area and ticketing system to improve the patient experience. All uncollected prescriptions and refill requests previously submitted will now be available for collection at the Smith Road Pharmacy. Request your refills online at hsa.ky via WhatsApp 925-6534 or call 244-2715. For more information about our pharmacy hours, visit hsa.ky.
HSA's cardiology clinic is now located at Smith Road Medical Center. Our cardiology team provides expert care and treatment for heart conditions such as coronary artery disease, heart failure, arrhythmias, hypertension, congenital heart diseases, among others. The new location offers state-of-the-art cardiac diagnostic testing, including echocardiograms, ECGs, and stress tests. To contact, call 949-8600. At HSA, your heart matters to us.
Now back to Healthcare Today with HSA and our host, Chuck Taylor.
Welcome back to Healthcare Today with the HSA, talking here about the upcoming summer student internship drive. I have with me, I want to say the coordinator of it all, because you do so much, you wear so much hats. So go ahead and introduce yourself to our public again.
Yes, hello everyone. My name is Marsha Eleweanya, and I'm the Training and Development Manager at the Health Services Authority.
And so, Ms. Marsha, before we left, we were talking about the non-traditional roles that are great opportunity for folks coming into the summer internship program. And now, people say, I'm not good with biology. I can't, I can't take the sight of blood and I can't do, but there are other things that support and make the HSA run. Tell me a little bit about that.
Yes, absolutely. So we mentioned earlier about our dietary department, which is one of those support services, but we do have a department that actually supports services that deals with everything infrastructure with the HSA. So if you want to do construction, you have a department, because then they actually do the buildings, do the fit outs for the different departments. So HSA is always expanding because our country is growing. And so we also have to expand the healthcare to match the needs of the population as well. So if you're interested in construction, you're interested in architecture, as I mentioned before, you can definitely come to the HSA and be involved in that. You have persons who are going to be, you have to
electrical,
the electrical, yes, definitely. So all that involves with construction, you're going to be a part of that if you choose to do support services. And you can go around with them. You will have valuable experience with the team. They are very experienced, they're qualified, and so they will give you all the tools you need for an occupation within that field. We also have persons who do the inspection. So we have the health and safety department who now goes in once the infrastructure is set out to say, okay, is this befitting for the service that we want? And so those persons going to do the inspection. You can follow those persons who we have in the health and safety department to see how do we look at it in terms of fire hazards, safety for our patients, infrastructure wise. And so you will have that valuable experience as well going in. And that is before we now get our certificate of occupancy, because we do the inspection within our organization, and then we apply for that certificate of occupancy.
Wow, that's really good. You don't think about that the running of the healthcare facility plus the growing of it, because we are constantly a culture and a country that is on the upswing. We have tons and tons of needs, and so you have to do some purpose-built things and things of that nature. So the HSA do all of that internally, and then they apply for it outside, which I think is a great opportunity for our young folks who may not want to take that traditional route of healthcare, or maybe the business model may be different for what they're thinking about.
Yes, absolutely. So if you're not thinking traditional in terms of a clinical profession, that is fine, because we do have those non-clinical areas that we really do want our young Caymanians to take the opportunity and get some experience in those areas. The administration area is another one that we do want. The marketing, we do have a marketing department as well. Okay. And so if you're interested in that, interviews, we have persons who do digital marketing, our website is there. So those are great opportunities as well. And that is part of those persons who help us to ensure that we're portraying the HSA and all the services that we offer.
Exactly, and one of the biggest things right now is digital marketing. Yeah. This is something that you can, and I tell people, I said, when it comes down to that, it doesn't matter what it is, it's just dialing in and knowing what you're about to present to the public. So it could be, sneakers, it could be healthcare. The idea is being able to be forthcoming with the information no matter where you are. So that's a great department. Plus, you still do print work. You still have magazines that you interact with and stuff like that on a global nation.
Yes, and we do. So we do need the persons within all of these areas to ensure that not just that you're showcasing the HSA, but you're also telling the persons out there in the environment, okay, what it is that the health services has to offer in terms of you are sick, where do I go? So that is also on our website. And we do offer a lot of range of services. We offer trainings as well. And so we want persons to access those coming from outside. And so you need to showcase those things for them. So if you're interested in digital marketing, we've got a marketing department, and we have great persons in the marketing department who want to help you. They will be quite excited to have you.
Sounds very, very good, folks. If you're just tuning in, don't forget the application process is coming up. If we can go ahead and just give them the details about that. And also the interns, what they should be looking forward to, because you said they have to do it on the website and things of that nature. If we could just reiterate that for them.
Okay, great. So our application opens April 1st, closes April 30th. So you need to get your application in within that time frame. You go to www.hsa.ky, and there you will complete the application and upload your essay as well. And for persons to be eligible, you need to be at least 16 years old, student within high school or university level, and you need to be Caymanian or have the right to be Caymanian to apply. And we need persons who are genuinely interested in the healthcare, because we want this to be your first step into the healthcare industry.
Right.
So if you're genuinely interested in healthcare, please do apply. Remember, you don't have to be a traditional person, so you don't necessarily need to be someone interested in being a nurse or a physician or those foundation careers. You can be in the administration area, you can be in biomedical, you can be in building, you can be in safety, you can be in accounting, you can be registration, you can be patient experience. Right. So there's so many areas that you can be interested in and still be a part of the Health Services Authority.
And folks, just a reminder, the HSA employs 1,200 plus workers within their I guess the umbrella of the whole company. So there's definitely something there that will resonate with just about anyone, whether you're thinking cybersecurity, something as specific as that, or you just want to be a data entry.
Yes.
It can be from one to the next and everything literally in between, as far as computers and the technicians. If you're looking for ground maintenance, things of that nature, maybe you're a person who loves flowers. Yeah, one of the, I tell people, I said, I go there and some of the most beautiful, my mom is, you had to take a picture of this one, because when you go into the little area, the courtyard that you guys have, she said, that's the most beautiful thing, so whatever you're looking for, there is an avenue for you to find it within the HSA.
Yes, so you do have a niche in healthcare, regardless of what your interest is. And so we want you to apply. You may have multiple interests, and that's okay too. So you can come on in, try an area, and then you can say, okay, this is not necessarily what I was looking for. We can try you in another area. And so we allow you to explore as much as possible, while you can also go through the different areas on the website to say, okay, if I go to cardiology, if I'm interested in that, what do I do? If I go to the lab, what it is that would I do? If I'm in registration area, what it is, you can go to those areas online. If you're still not sure, you can speak with someone once you've gone through the application process.
Exactly, folks. And so just a reminder, it's a 4 to 8 week program, and it's going to be kicking off June 1st.
June 1st to September 15th.
Okay, so definitely, folks, if you're going to be on island and you're going to be looking for something, and and I'd say the plus, but I did hear that it will be compensated within reason. I'm just tossing it out there. So she's smiling. She said that they will take care of you. We'll leave it at that.
We absolutely will take care of you. So it's a paid internship, and so we want to encourage the young folks. Yes, they're in the summer period. We know you have needs, and so we do have a compensation package for persons who go through the program, and that's also it's incentivizing and encouraging the young people to take the opportunity to come out there, find a niche for themselves, and we want you to come back to the HSA and be a part of the team.
And I was just about to ask you that. Is there a lot of recurring roles from people who have done internship to come back and say, okay, I'm looking for a job, or I did some training here, I want to come back for a second internship, or maybe find a job with you?
Yes, we have persons recurring. So if they're in college, maybe they're in their first year and they come back the second time around and they want to be in the same area. And so they continue to build on those experiences. So by the time they graduate, they're coming in with 4 years of summer internship experience to apply for the job. And so we encourage our young folks continue to seek those experiences, because how else are you going to get it?
Right.
And the jobs usually say, okay, we need 2 years or 3 years experiences. This is way that you can actually get that experience. To say, you know what, I did 4 summers, I did 8 weeks each, and this is my experience on paper.
Right.
So your employer can say you actually did do something.
Exactly. So true, folks. So definitely put it in your calendar. Go ahead and make sure you get the application in before the end of April. So April got 30 days, folks. So you got until the 29th at midnight to get it in. I'm being devil's advocate because I know sometimes we get so spend the half an hour to 40 minutes to get it done. Take your time, focus in onto it. And if you need to, handwrite the essay beforehand and then type it in, that's not a problem. We'll give you the time, but you got 30 days to do it in, and we want to make sure that you do that. So we're going to come back in just 2 minutes. We're going to start wrapping up, and we'll tell you some more details on how you can go ahead and get it done online. We'll be back in 2 minutes right here. This is Healthcare Today with the HSA. I'm your host, Chuck Taylor. Each and every Friday and Saturday at 1 p.m. we get together and talk about all things related to your health. We'll be right back.
Health Services Authority is now offering online payment options for patients. Patients of HSA can now pay their bills, including deposits, towards scheduled services online at payments.hsa.ky. The secure, new online payment system accepts debit or credit cards and is in addition to the available payment options of cash, check, and online bank transfer. For quick, easy, and secure payment directly from your phone or computer, visit HSA's new online payment system at payments.hsa.ky.
When you have a sports or fitness-related injury, trust the expertise of the HSA Sports and Exercise Medicine Clinic to get you back in the game. Our internationally trained and certified physicians specialize in sports traumatology, sports medicine, pain management, and orthopedic surgery. For treatment of common injuries such as tendonitis, arthritis, tennis elbow, rotator cuff, or knee tears, schedule a consultation with the Sports and Exercise Medicine Clinic at Smith Road Medical Center by calling 949-8600 or visit hsa.ky for more information.
The Health Services Authority's new pharmacy is now open at the Smith Road Medical Center. The new location features a large, comfortable waiting area and ticketing system to improve the patient experience. All uncollected prescriptions and refill requests previously submitted will now be available for collection at the Smith Road Pharmacy. Request your refills online at hsa.ky via WhatsApp 925-6534 or call 244-2715. For more information about our pharmacy hours, visit hsa.ky.
The Cayman Islands Health Services Authority's general practice and public health clinics have relocated to Smith Road Medical Center. At the new location, you'll receive top quality care in a comfortable, modern space, enhancing your patient experience. Do you have flu-like symptoms or other non-emergent illnesses or injury? HSA's new urgent care walk-in clinic is now open at the main hospital campus. The new general practice location is for appointments only. For more information, call 949-8600 or visit hsa.ky.
HSA's cardiology clinic is now located at Smith Road Medical Center. Our cardiology team provides expert care and treatment for heart conditions such as coronary artery disease, heart failure, arrhythmias, hypertension, congenital heart diseases, among others. The new location offers state-of-the-art cardiac diagnostic testing, including echocardiograms, ECGs, and stress tests. To contact, call 949-8600. At HSA, your heart matters to us.
Now back to Healthcare Today with HSA and our host, Chuck Taylor.
Welcome back to Healthcare Today with the HSA. I'm your host, Chuck Taylor, talking with Miss Marsha about everything in the summer internship program. And I say that because it's really kudos to our HSA for giving our young folks the opportunity each and every year to come in to their summer student internship program. And then I said to her earlier, I said, I literally cannot think of any U.S. hospital facility that takes in any summer internship without prior experience. And when I mean prior experience, they're talking, 2 and 3 years experience. But here we give our young folks the opportunity to build so that they can be a global powerhouse no matter where they are, no matter what they do. This is a prime opportunity for them to take advantage of it and reach out and get it done.
Yes, absolutely. So, folks, we are encouraging you all to apply. Remember, our internship application opens April 1st and it goes through to April 30th. It's there for you to build that valuable experience that you need to go out there to start your first job in the healthcare industry. We do have traditional roles, so you have experience with going around with the nurses. If you want to be a registered nurse, if you want to be a physician, we do have that experience for you as well. But we do have the non-traditional, which are support services. So we have the lab, we have the administration, we have accounting, we have registration, we have customer service, we have IT, we have marketing, we have support services, dietary. So we want you to apply regardless of what it is that you're interested in. And remember, we do have this being offered on 3 islands. So if you're in Faith Hospital or you're in Cayman Brac, please do apply as well. And if you're in Grand Cayman, please do apply. Our internship program will run from June 1st to September 15th. So a 4 to 8 week program for persons who are interested. Complete your application online at www.hsa.ky, and you will be hearing from us as to whether you're selected as a participant in the program. If for any reason you're having any questions, you're having difficulty, you can send us an email at training, training @hsa.ky. So that is only if you're having a question. Please do not submit your applications through that email. Applications are only being taken through our website at www.hsa.ky.
Makes it really easy, folks, at www.hsa.ky. That's the online application. It can only be done online. I will tell you that it will include an essay, so you can also go ahead and fill that out there. But if you have any questions outside of that pertaining to it, is training at hsa.ky. So, folks, please take advantage of this. This is literally a once in a lifetime thing that happens, and it will alter any young person's perspective of what the traditional role should be. It gives you great opportunities to expand on your horizon, and also you can get to talk to professionals who live and breathe this every day. It's nothing. It's like, when they say, "Oh, we have training day at the school," and all of the professionals come there. Imagine you having one job, and all of the professionals that you could ever expect to see doing different jobs are in that one location. That's what the HSA really provides when you think about it.
That is what we provide. And so if you came and you wanted to do nursing, you get to see the physicians. How does a team interact? So you're seeing the full healthcare field interacting to take care of one patient.
Right.
So that is the realm of what the experience is going to be all about. You're going to see how your role as someone in construction going to influence how we offer healthcare. So you're going to see how your role as someone who makes the meals influence someone. So you may have a diabetic patient, and so you have to tailor their meals to that particular patient and the need that they have. So whatever it is that you're thinking of, come on down to the Health Services Authority, join our summer internship program. You will have hands-on experience, access to professionals with years of experience, and the knowledge and skills to assist you to make that first move into the healthcare industry.
Sounds absolutely phenomenal. Thank you so much for stopping by here this afternoon and giving our young people some hope, some spark. Because sometimes they think, "Oh, there's nothing for me to do. There's nothing going on." We got a lot going on right here in this little island.
We do have a lot going on in all 3 islands. So please join us. We're waiting for you. We're excited to have you and to offer you that valuable experience that you require to move on from there. Make your first move into the healthcare industry.
Thank you so much for stopping by here.
Yes, thank you.
Keep it right here. This is Healthcare Today with the HSA. My name is Chuck Taylor. Each and every Friday and Saturday, we get together and we talk about all things related to your health over at the HSA. This is about the summer internship program. Make sure you go ahead and do that.